Hi, I'm Dr. Norman Rowe, and I'm a board-certified plastic surgeon. I want to talk to you a bit today about penile augmentation. There are basically two ways that you can augment the penis, in length and in girth. And what I'm going to talk about is augmenting the penis in girth. There are a couple different ways that you can augment the penis in girth: surgery and non-surgery. And again, what I'm really going to focus on is augmentation of the penis, of the girth, without surgery. One of the more common ways that you can augment the girth of the penis without surgery is with hyaluronic acid. Now, what a hyaluronic acid is a medication that is found naturally in your skin, and all we're doing is adding more hyaluronic acid to the penis to augment something that you already have. The procedure takes about 20 minutes, depending on how much you want to augment the penis. And the filler, and hyaluronic acid, which is a filler, which is again found naturally in your skin, the effect lasts about 2 years. There are some hyaluronic acid fillers on the market that last a shorter time, but I find that most patients that I treat desire the filler or the hyaluronic acid that lasts about 2 years. The procedure is relatively painless. I do use a local anesthetic, which I inject into the penis to minimize any discomfort, and I put a topical anesthetic on. The patient comes into the office after we obtain a history and a physical, and we decide what size they would like to attain. We decide how much filler we're going to inject in the penis. Now, one thing about the penile skin, it is made to stretch. And with that in mind, you can inject as much or as little as the patient desires. I generally tell patients to be conservative with their injections because you can always come back and I can add more to the penis, but it's a little bit more difficult to remove the filler if you think that you are too large. The procedure takes about 20 minutes from start to finish. That includes the physical, that includes the numbing, and that includes the procedure. A lot of my patients ask me how and if it will affect their sex life. And usually I tell patients it doesn't affect their sex life in any adverse way. Most patients relate that it actually improves the sex life. Another question I get from patients is, are there any side effects? Relatively few. Occasionally there can be some asymmetry in the penis, which we do correct at a follow-up visit if necessary with further injection. The good thing also with the hyaluronic acid fillers is the effect is seen almost immediately. The filler is the effect of the increase in girth of the penis can be seen the moment you leave the office. And again, how much of an increase in girth, that really depends on how much you want the penis to be enlarged. Another option that my patients have is to use platelet-rich plasma. Now, what platelet-rich plasma is, it is a technique where we take a patient's blood, one vial, which we draw from their arm, and separate out the platelets, which are found in the blood. And then we in turn take those platelets and inject it into the penis. Now, this does two things. One, it gives the penis girth, but more importantly, it helps a patient if they suffer from sexual dysfunction or erectile dysfunction. It helps the blood flow to the penis. And when you talk about increasing blood flow to the penis, that means one thing: an increased erection. So platelet-rich plasma is a method by which we can treat a patient who suffers from erectile dysfunction, in addition to a patient who desires to have their penis enlarged. Now, you can do both platelet-rich plasma therapy and hyaluronic acid therapy at the same time. With the platelet-rich plasma therapy, again, it is painless. We do give a patient a numbing medication and a shot. With the platelet-rich plasma therapy, as opposed to the hyaluronic acid therapy, the platelet-rich plasma therapy can require a second and even a third treatment in order to obtain optimal results. It does require once-a-year therapy in order to maintain those results. Obviously, if you have any questions or want to schedule an appointment, please call my office at 212-628-7300, or obviously you can visit my website. That's www.normanrowemd.com. Thank you.